I've performed countless rhinoplasties, and I've also had one. What did I learn from my rhinoplasty? I'm Dr. Angela Sturm. I'm a double board certified facial plastic surgeon, and at the end of my fellowship, I had a rhinoplasty, a septoplasty by my fellowship mentor, and I feel like it has given me a great insight into what that is like. Super grateful that he did it, and people say that is the aspect of me that looks like my sister, so you did a good job. I did not realize how self-conscious I was about my nose until I did something about it and really felt good. I didn't have to worry about, what angle do I take a picture? What is someone looking at this? Or I didn't have to worry about that anymore. And my mom told me I should have done it a long time before that, once she realized how much better it made me feel about myself. But it all works out the way it's supposed to, and you do it at the time that you're supposed to. From a breathing standpoint, that is actually why I initially decided to do it, because I played sports. I'd been hit in the nose with elbows and basketballs and volleyballs and who knows how many times, and one side of my nose was just very difficult to breathe out of all the time. And it didn't matter what I did. I'd been told since I was a kid I had allergies. I had allergy shots from the time that I can remember, took allergy pills, and they helped a little bit, but I always still struggled, still had a hard time with it. So when he looked in my nose, now he did the, hey, come look at this, which is never good when you're the patient, because you want to be boring. You want to be a boring patient, but my septum was very, very deviated, and it was a teaching point to some residents, which is, giving back, I guess. So he was able to straighten up my septum, and one of the things I learned from that, and which I know that it was different to experience it, is you're always going to have a favorite side. So if you have a really, really deviated septum, you can't take out all of it, and you can't make it completely symmetric, but you can make it a whole lot better. So I don't notice when my nasal cycle switches from one side to the other the way I did before. But I know sometimes I breathe a lot better, and sometimes I breathe pretty good. I'm definitely better than what I was, and it's life-changing. Breathing better, it helps me exercise, run longer, exercise better, sleep better. The change in seasons don't bother me as much. I notice it, but it's not as difficult as it was before. So just huge in life-changing lifestyle kind of changes. And then from almost a psychological aspect, it gives me insight into kind of how you feel, because I knew what I wanted it to look like. We did computer imaging, we drew it out. I said, I want it to be straight. I don't want a scoop. The first time when you take off the cast, you're like, yeah, it's what I wanted because it's straight. It's all objectively the things that I said that I wanted, but you're not sure, and I try to tell patients, especially if you're anxious about it, that's okay. It's okay to be not sure in the beginning, and it does not hurt my feeling as a surgeon at all for you to say, I think so. Okay, because that's honestly exactly how I felt. Objectively, it looked good. It was very positive, nothing negative. I just didn't know yet. I saw myself different than I'd ever seen myself before. And so there's a little bit of processing that had to go on of like, okay, this is different now, and this is how I look. And a little bit of swelling to go down, because even between day 5 and day 10, it was a lot easier on day 10 when I took off the tape of just look at it and say, okay, yeah, no, that looks good. I'm excited. This is really good. And that may be day 10 for you, and that may be a month, and that may be 3 months. Everyone's a little bit different. Everyone's journey and process of healing is a little bit different. So there may be a swelling component. There may be just you, whatever brought you to that point, how you're processing what's going on at that point. And it's really helpful to have supportive people around you that can say, yeah, that looks so much better, or yeah, that bump is gone, and see the positive things about it, because that is really reassuring whenever you're trying to process what you look like for the first time since you're a little kid. So having those people around you that are supportive that you did this is absolutely key. And like I said, I tell patients, especially if they're nervous, all of those things are normal. It's totally normal to be pumped from day one, and you look at it and you're like, yes, this is great. I'm so excited. And it's also okay to be like, I think so. I think I like it, and not to feel bad, and not to, if you're on either end of the spectrum, because all the patients that I've seen on the whole spectrum all ended up being happy. Like, there's obviously going to be, nothing's perfect. There may be little issues and there may be little things here and there, but just because you feel one way in the beginning does not mean that you're going to feel it or a different way in the end. I also learned, that nothing is perfect. I was not perfect before and I'm not perfect now. There were some asymmetries, there's little bumps, there's one nostril's a little bit higher than the other, but would I do anything about it? Good. If I sit there and I think about it and I look at it, trained to do this all day, every day, and I can find all the things that are wrong with it. I could find you a list, but does it truly impact my life? Does it make me feel any better or worse about myself? No. And so that's not something that I think about or worry about. And it's one of those thoughts that you think you have and then just let it go. That overall, is it better? Absolutely. Am I glad I did it? Yes, definitely. And would it be worth doing another surgery to fix those tiny things? No, not at all. Not at all. I'm good. I'm happy where I'm at, and that's okay too. Understanding that I did this and I did this to look better, and I made that decision. And is it going to be perfect? Like nobody's totally perfect. And loving yourself with where you're at, what you have, and seeing all the good things. So I think it taught me a lot, and I hope it is something that I can help pass on to my patients, and something that I can help pass on to whoever's watching, that all these things are normal and you even think it and feel it, even if you're a facial plastic surgeon. And let me know if you have any questions. I'd love to hear from you. You can find me at www.drangela.sturm.com.